where I'm going with this is I think that this whole idea of not feeling enough is a very common limiting belief that women share. And I think the other part of just metabolism getting so jacked up, as well as other things, for sure, the digestive system too, is this emerging sort of complexity around toxic burden. Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. So this is part 2 of a 3-part interview I do with my friend and colleague, Kelsey Weaver, who's also a functional diagnostic nutrition practitioner with a practice in Oregon. In part 2, we're going to be digging a little deeper into toxicity, some of the connections we see with toxic burden and things like metabolic health, gut health, and other chronic health issues. We're going to be really getting into kind of some interesting things in this particular session.
I really truly believe that people wear their stress like a badge of honor, saying, I am so busy. I have so much on my plate, but look at me do it anyway. I do it anyway. And I stretch myself so thin because I am like Superman or Wonder Woman or whatever,
Mhm.
and I can handle it. But what we don't recognize until it's too late, because we don't see the symptoms until it's too late, is like, oh, suddenly 5 years from now, my body's in pain. I'm not sleeping. My libido's gone. My hair's
Mhm.
starting to fall out, and I have no energy. And it's like,
Mhm.
but nothing happened. It came out of nowhere. It didn't. It didn't. But as that 5 years progressed from you going balls to the wall with HIIT training every damn day to starting to have symptoms, you were slowly pulling out all of these beautiful flowers that were in your garden until you have a barren wasteland. You just
Yeah.
didn't see it because you were faced in the other direction and you were wearing your badge of honor. That is such a common thing in today's society. And it makes me so sad because somehow we need to change the narrative.
Yeah, absolutely. And I think you're actually providing like a perfect segue into my next kind of piece I wanted to talk about. And this does still connect to the metabolism and the whole like weight loss resistance piece of it. But yeah, I think so. We're kind of getting into a little bit of the mental landscape piece of this now, Kelsey, right? Because we're kind of, just as I listen to you talk about that, one thing that just strikes me is I think, especially in the women we serve, which I would argue for most functional practitioners, probably the majority of our clientele is women. I don't know if that's because women just tend to have more interest in taking their health into their own hands, or just because of how we're wired to be more social emotional creatures. We're more invested in improving our health so we can relate better to the people that we care about in our lives. I don't entirely know why that is, but I feel like women tend to predominate like in our client sphere, right? But where I'm going with this is I think that this whole idea of not feeling enough is a very common limiting belief that women share. And I mean, we could debate on the origins of that belief forever, right? But where I'm going with this whole thought is that I see it for sure. And I think the other part of just metabolism getting so jacked up, as well as other things, for sure, the digestive system too, is this emerging sort of complexity around toxic burden. And so, kind of one thing I wanted to touch on a little bit is in my world, the most complicated cases I've worked with have been those people who have had one or more toxicities, whether that's like toxic mold exposure and they're colonized. They might have actually Lyme disease, simultaneous to that. Sometimes it's even metals or chemical toxins. And one of the common ways that actually does show up is excess weight on the body. And I've actually found in the cases, the few cases I've worked with where weight has been more of an issue, where those clients really struggle to lose, almost always there's an unusually high toxic burden at play. And I've just come to the conclusion time and time again that if that's the case and we've done everything, they're exercising appropriately, their sleep is dialed in, they're doing all the dress principles. That's an acronym we use in FDN. That stands for diet, rest, exercise, stress reduction, and supplementation. Our foundational core, and they're still struggling, I almost always suspect toxic burden, especially if there's other systems of the body or other things going on, right? And I think like you and I have kind of talked about this in our clinical advising sessions previously. Like I've started to realize that there's almost always like this truism between if the physical body is toxic, there's got to by definition be mental, emotional, energetic toxicities coexisting, right? And those things almost always tie back to some history of childhood trauma, even just things that we would write off as like not big T traumas, like maybe attachment style issues, or I mean, some of these traumas can go back intergenerationally, right? And like that is really big, heavy lifting for the client. But I think that there's still a portion of our field in functional medicine that hasn't fully come to recognize that that's just as important as the physical interventions we try to do, right?
I totally agree. I think, and I can't claim to know everything about the universe. None of us can. And so
Right.
there's things that I don't understand. I don't understand how these different energies in the universe and in our body play such a big role. I want to learn more about that, but it is fascinating. And what I do know for sure is that there is always a trend with clients that, come to us as FDNs that really have struggled because I don't know if you've done, but I do a functional timeline with my clients when
Oh
they
yeah.
come on board.
Yep.
And it's a 75-minute conversation of just tell me about your entire life from start to finish. And sometimes it goes a long period of time. It's
Mhm.
often very tearful. And 99 times out of 100, these people have gone through so much in their life, and it's the ACEs, right? The adverse childhood
Mhm.
experiences, it's the traumas, it's neglect, it's bullying, it's body dysmorphia, it's eating disorders, it's abuse, it's so many things, or it's exposure from the environment to molds and toxicity that they didn't even know about because they couldn't see it on their body or it didn't manifest yet.
Mhm.
And so it's so interesting that you explain that with toxicity and trouble with weight loss or weight gain too, because what we know for sure is that toxins love to live in fat cells. Love,
Mhm.
love, love. So why would your body say, oh, yes, let me get rid of these fat cells when the toxins are saying, yes, but those are my homes. Like I need those, right? So your body isn't going to just give that up easily because your toxins are saying, hell no, I need somewhere to be. And
Exactly.
then when we start losing weight, one of the most interesting things to me is when people start losing weight fast, right? And
Mhm.
they'll go on some freaking crazy ass diet and they're like, I lost 20 pounds in 2 weeks. That is out of control. Like, that's too fast, right? But they feel like shit. And
Mhm.
they feel like shit because, in large part, right, they're getting rid of all of this body fat and the toxins have to go somewhere. And if their liver and all of their other detoxification organs are not keeping up with, getting rid and expelling these things from the body, they're going to feel terrible. And that happens so often. And that makes me just cringe a little because I'm like, oh God, where are they going to go? They have to go somewhere. Are they going to the brain? Are they going to your thyroid? What parts of you are they going to? That scares me. So, this is another reason, and I don't want to talk about weight loss forever, but this is another reason why the rate of weight loss is so crazy important because of how toxins, like you mentioned, they just live in the body and they live in those nasty little fat cells.
Oh, for sure, Kelsey. Yeah, and I've heard the exact same thing. And when that comes up in my world, I'll kind of explain to people like, believe it or not, fat has a protective mechanism to it. That's a place for the body to sequester stuff so it stays away from the vital organs because it makes sense, right? Like we want our liver to keep functioning. We need our gut to keep functioning as well as our lungs. Not to say those organs can accumulate toxins, they definitely can, but the body is very intelligent. And this is partly why I was drawn to functional medicine initially, was because it just made so much intuitive sense, right? Like, of course, everything's connected. Of course, the body has its own innate wisdom and knows. Like, I would even argue that when things get out of whack and these symptoms or these illnesses, if we want to call them that, even though they seem like it's the body going crazy or, presenting these issues, if you actually flip that and look at it from another direction, it's really our bodies trying to make the best adjustment it can to different things going on. And a lot of those things I don't think we fully understand or we could ever know the full story because, like you said, there's such an interconnection between the psyche and the physical, and they're always both playing a role. And then there's all of kind of the organisms that live within us, some of which are beneficial, but when our body as a whole does become more conducive to pathogens, I mean, there's always that psyche playing a role there too. So, I think that with the whole like toxin thing and just like fat accumulation, I mean, yes, absolutely. Like that would be the worst possible thing for someone to drop 20 pounds in 2 weeks and then feel like crap. And yeah, those toxins won't necessarily get eliminated from the body. They're going to get often dumped and then reaccumulated somewhere else. And oftentimes it's like the nervous system, the brain, nerve tissue, that type of thing, because it's also a very compelling place for toxins to live. So, yeah, I've actually come to think that in the most challenging cases I've had where we've run the foundational protocols that like we're trained to know how to do, whether they're gut, toxin elimination, what have you, and a person is not responding well or the response is minimal and we've done like a good round of whatever it is and now we're retesting, I've really kind of come to accept that there's a deeper, probably more psychological, emotional factor here that needs to get set in place, or you could say like almost like switched or changed in some way to allow the physical interventions to work better. And I've really kind of, although this is like very esoteric, I've really started to kind of get more and more curious around like, like what do you do when the physical interventions aren't working? You don't want to say, well, we've tried everything and now like I'm out of answers, right? But like luckily we still have tools we can offer, and there's always, partners, people we can partner with who can help with that capacity. But I definitely have grown more and more in my appreciation for just like how much of this sometimes does come back to the heart of the client and how much they're willing to actually in some ways introspect and face head on some of these things that go way back for them, or maybe some of these things that go back in terms of their parents' generation or their, grandparents' generation, and really sort of start to work with that stored energy disruption in the body and try to resolve that and neutralize it so their body can start to receive like the physical things we're trying to do to support it better, right?
I agree. Do you find, or have you kind of flirted with the idea of when you're bringing somebody on that you're like, I really feel like we should take a toxic burden? Or do you think I the reason I ask this is because sometimes, we have all these labs that we like to run, which is great. And I just find that I wonder how beneficial that would be to just run a tox burden on every single person that came on, just to have all of that information first. Do you
Mhm.
find that that would be beneficial in your practice or just generally speaking?
Oh, definitely, Kelsey. I guess the way that I tend to approach that, because too, those tests can be quite pricey just because if we're going to do one, often we're going to check a couple, if not three different things, right? Because if someone's mold sick, very high chance they also have chemical toxins or metals or even Lyme, right? And so this is kind of the finesse in our world of like right out of the gate, how do we be good, I guess, good stewards of our clients' resources and get the right testing that's going to give us enough data to work with to confidently fill in the gaps of what we need to know to write effective protocols without overdoing it or underdoing it. That's the hard part, right? So the way I tend to approach that is, and again, in my world, because I do tend to have more of the gut health, autoimmune people, I would say it's pretty safe to make an assumption they're fairly complexly ill, especially because often they've been to a conventional GI doc or two or three. They've gotten frustrated with that process. They might have even tried another functional practitioner who's not had a very holistic approach and failed that. And now they're like, okay, I may be willing to try you, right? So I'll often do some sort of conversation, maybe not the whole functional timeline for 75 minutes like you do, but I do want to know, like, what have you tried that hasn't worked? And have you actually tried functional medicine? Just so I can ascertain if this other practitioner they saw, if they're functionally trained, hadn't explored the possibility of toxicities, man, that might be a missing piece. And so, in my initial assessment, I actually do have all of my clients take the MSIDS, which is like, I can't remember exactly what that stands for, but it's the Horowitz multi-system like inventory questionnaire. It's basically a really nice it is pretty extensive. I'd say if I had to guess, it's probably like 50 to 75 questions, but they all go back to like Lyme disease potential. And then the other one I like to run on my clients or prospective clients is the Ritchie Shoemaker like chronic inflammatory response syndrome questionnaire, which isn't quite as extensive, but his uses scoring in symptom clusters. And so I can quickly look at both of those and then total up those scores. I like them because they're very quantifiable. So it's like we've
Mhm.
got numbers based data, which most people can understand intuitively. And then I'll show them like in a presentation form, like this is a scale for both of those. And like this is the number you can max out on. And you're like here on the spectrum, which is like super compelling. And if I run both of those and they're both telling the same story and I'm seeing like moderately high to high numbers, I'm like 75% convinced that you have biotoxin illness. I'm not entirely sure if it's mold or Lyme or both, but if at all possible, I think we should run these tests. And if we can do both, if I suspect both, yes, that's what I'll recommend. If they can't for whatever because of cost, issues, I'll usually say let's at least do mold because that's the deeper of the two issues. And if we miss mold, it's going to be so much harder than I feel to get them the results they're looking for in terms of, regaining proper gut function because mold absolutely will colonize the gut and the sinuses. And, if we don't know it's there and it could even be in the home they're living in, which is like worst case scenario. But if that's happening, it can be really hard to get them to a place where they're feeling like they're making those big gains in their health. If not, sometimes some of those gut eradication protocols can also push mold toxins. And if they're in a moldy environment, that can actually inflame them more and make them sicker. So I definitely don't like to miss it because then it becomes more complex. And if they start to react to the protocol, and then I really suspect it, that's a tough, I mean, I'm sure you have these conversations too, Kelsey. It's like having those conversations with clients, like, why am I like getting sore joints or why am I having massive headaches? Well, now you have to go back to like, oh God, did we miss mold? Or, are we pushing something we didn't know was there? Are you just sensitive to an ingredient? Or are you herxing? Like there could be so many possibilities and it's super uncomfortable for them. But we have to then try to like, put on our hats of like, okay, what's the most logical explanation here? So I hate missing stuff. We ultimately will anyhow, because there's no way you can get every single answer every single time. But I think with the toxin piece, yeah, I like to assess for it, at least using some pretty good forms in the beginning, because if it's there, the client at least has that information. And then if they say still, like, I don't know if I'm ready to do that, let's just focus on the gut, we've at least had that conversation now. And if we hit a roadblock 2 months down the path, I can kind of go back to that and say, hey, this might be because we chose not to look at mold or Lyme as a possibility. Do you think you
Mm.
want to now go back and add one or both of those tests on, right?
Are you struggling with chronic diarrhea or constipation and have been told by your doctor that there's either nothing wrong or that you're going to need to take a med for the rest of your life to control symptoms? What if there was another way? A way that empowered you to take back your health through a smart nutritional strategy and through running the right testing to identify true root causes. If you are ready to say yes to self empowerment and to starting the journey to real improvement in your gut health, click the link to grab my free e guide.
Yeah. And then when you do those questionnaires, because you do that with everybody, right?
Mm-hmm.
So when you do those questionnaires, how often do you suspect, oh gosh, there's some toxicity here that's going to be a roadblock for us?
Oh gosh, at least 50% of the time, I would say.
Yeah.
Often people's scores are coming. So I kind of make it really intuitive. I color code it so it's like a green, yellow, red on that like scoring range, right? So they can see like kind of immediately like yellow, and I'd say most people come out in the yellow because that just tends to be the case. Like I feel like even probably in the weight, loss world too, there's gonna be toxicity to some degree. But I will tell you this, like before I started using those two specific tools to assess people, I was only using kind of a more general format, like I think it was maybe 30 to 50 questions just around general toxicity. And people would time and time again score really low on that, even though I'd look at their symptom presentation, I'd be like, I really think that they actually do have like a toxic mold burden or possibly even Lyme disease. And so once I started to be like, okay, I'm going to kind of ditch that and I'm only going to work more with these other two forms, that's when I started to get like the more compelling data. And just the more I've gone down the training rabbit hole and I've seen how other really good practitioners practice, especially in like the Lyme circles, I know that these are really great assessment tools that we could be making use of. And I just thought, you know what? I have nothing to lose in doing this. And at least it's there. And like I said, if a client doesn't want to pursue that, well, I put it out there, right? And if they do, great. Like that makes me even more confident that we can at least know or not know. And if it is there, man, we better like work on that because that is absolutely going to be a limiting factor for them, right?
Yeah. I mean, and that's so interesting because it makes me think about how many people in the population, in general population, are not coming to functional practitioners, right? Or holistic
Yep.
practitioners that
Yep.
have these issues, right? Millions of people are not being treated by but what I would say that's interesting about what you said is that people that are brave enough to say, I need to seek help, and okay, I'm going to Courtney, and you're seeing at least 50% of these people with toxicity, what does that mean for the general population? Does that mean that over 50% of us are carrying like a high toxic load? I would venture to say yes, but
Hmm.
it manifests in everybody's body in very unique ways, or they have a high enough metabolic reserve to where it hasn't manifested at all yet, and that's okay too. But I think that I'm going to turn the tables on you and ask you a question now because I think
Yeah.
this is interesting. When people if people have a high toxic load that they cannot identify or they just don't know that it's present, right? Let's just
Mhm.
pretend they don't know that it's present because this might be the first time anybody has heard this on your podcast.
Yep.
How is that going to then basically pull away from what you're trying to do with them? How is that going to manifest in their body? And then what is that going to do if they don't identify that in the beginning when they're trying to go through these protocols?
Yeah. So it kind of depends on what it is, actually, Kelsey. If it's mold, that to me is always the biggest issue to work with, like the most complex and the most challenging from a practitioner standpoint. That's just been my experience. And I would say if mold is at play, most people have some degree of like symptom burden that's unusual, meaning like it's more than just like fatigue. Typically, it's like gut disruption, whether that's like reflux or alternating bowel issues, constipation, diarrhea, or abdominal pain, right? Or they're having like recurrent headaches or lots of joint pain. Like typically, I'm looking for like multi system. So, if they come in and they've got mold as a big limiting factor, we've done the testing, we identify it. Well, I guess you're kind of asking the question, what if we don't identify it? So if we don't identify it, and let's say they're coming in maybe just for general health purposes. Let's say they're not even like a gut person. They're just like, I just want to optimize my health. I have a little bit of sore joints and sometimes I get headaches and I feel kind of fatigued often. Like, please help me do your foundational testing. And let's say they have mold as part of the picture and I don't catch it or they choose not to test for it, what often I'll find in that process is that their symptoms don't respond well to the gut protocol. So, like, maybe we should lay the scene a little bit. In our world as FDNs, we are trained initially to run foundational testing, and it's typically looking at gut function, hormones on some level. There's like a profile that kind of looks at leaky gut and then metabolic wellness. And those are like shorter panels that look at 3 different factors. But generally speaking, I'd say we're kind of looking at inflammation, gut function, and hormones as our foundation, right? So let's say, with the gut, we're almost always going to find stuff. I don't think I've ever run a GI map and there's been like nothing to work on there from like an eradication or a pathogen standpoint. So if mold is there, but we haven't caught it, often what I'll see is we'll run that gut protocol, and then particularly the eradication piece, like let's say we're going after some bacterial overgrowth or H. pylori, they will usually not have a lot of improvement in their symptoms, or they could even have more what I would call like reactionary types of issues where we think it's like a die off, but it just doesn't stop. Like it's not just 7 to 14 days. Like it would be ongoing until we stop the like herbs we're using, say for the eradication. Um, that's really, really common. Or sometimes with my more robust clients, they might not notice as much of a reaction to the eradication piece, but if they choose to retest, say like 5, 6 months later, we won't see a huge change in what's going on in the gut. And so that can tell me too, like, wow, like we didn't actually change the bacterial overgrowth all that much. We didn't really hit the H. pylori. Like this is unusual. Typically, these products are really high quality. They should work for an issue like this. That tells me there's some deeper limiting factor going on here that would explain like why, for whatever reason, the immune system wasn't supported with those herbs to go after and get rid of those things. Is it that the H. pylori didn't leave because it's buffering mold? Or is it that the mold, if there was mold there, right? Like it could be suppressing the immune system to a point where there just isn't the resources to actually effectively clear and get those pathogens under control. So that's a really common one I see. Lyme is very similar to mold. I feel like that also works very, very similarly in the body. It tends to make people much more sensitive to everything under the sun, whether it's foods or supplements. They tend to present more complex wise. If we were to miss it, and let's say their main symptom was like gut presentation, typically I find there too, similarly, if I just run a gut protocol and we get to eradication, especially, they'll start to have, issues tolerating the supplements I'm giving them. And that's like actually pretty common in my world. Like that's the level of person I guess I attract, which can be really, really hard. And sometimes even when we know it's there, it still happens. And then it's like, okay, what can we do? And sometimes we have to actually try different products because it could be they're actually ultra sensitive to an ingredient in the product because they've got such a high degree of like, immune activation because of those deeper biotoxin issues. And they just have all these sensitivities. And that can be a really complex thing to work with. So I would say like, it's not common. We're going to see people from the general population that don't have a pretty high degree of suffering that are willing to opt in and work with us because, I mean, you and I both know this. This does require out of pocket investment, right? Like it requires people that are willing to um, sort of subscribe to the belief that to optimize their health, they're going to have to take matters into their own hands, get a functional practitioner who can guide them effectively, do it on their own time, right? So that's a totally different part of the population that's gotten to that belief system. And then on top of that, they've got to be adequately motivated, meaning that they're struggling in some way, shape, or form. So, it definitely does tend to be like the sicker people, if you will, that are coming in. And so for me, it's always been pretty easy to get that immediate feedback. If I'm running a protocol, they're not responding well, we haven't checked for Lyme and mold, especially, that really makes me suspicious. I would run those 2 questionnaires if I didn't and see if there's like data to back that suspicion. And then if there is, I'm like, we might need to do these tests. Or if you don't do these tests, we might just be stuck right here because I can help you with the diet and they can get better to a point, Kelsey, but there's only so far you can go. And I've had to explain to clients that have gotten to that stuck point, like you can continue to function this way and you can live on an AIP diet forever. Like as long as you've got a good variety and you're eating nutrient dense whole foods, like you can get adequate nutrition that way. But you have to ask yourself, like, am I okay with just stopping here, knowing I have mold colonization, knowing I might have Lyme disease? Like that's a big question. And it's kind of like knowing you've got a monster in the closet but wanting to just shut the door and not deal with it, right? Like it's sooner or later, it's gonna cause issues, right? Like we know that. And so that's a tough like situation, but ultimately, the client has to make that decision. And for us as practitioners, that can be very challenging because it's a patience game. It does require a lot of like trial and error, even with a smart strategy, because everybody's going to respond differently. And there can be so many sensitivities and reactions that come up. So that's the tougher part, I feel, of my work. And then the emotional upset that comes with like just having to even recognize that like I have this level of illness, I now have to investigate my home or whatever, right? Like that's a big, big thing for anybody to have to deal with.
And it's so hard. I've had people with mold, as you know, and you just have to push the pause button on everything else that they actually wanted to work on. And it is
Yeah.
devastating, when
Yeah.
people, come to us and I really feel like my hormones are out of balance. I'm not sleeping well. I have anxiety and I really want to lose weight. And we can kind of start to think about toxicity in that way. And if they come back as mold positive, you know, we have to have that conversation, at least I have, and many times now, where it's like, I hear you. I am so sorry. We don't get to work on that quite yet
Yeah.
because we have that monster in the closet that we
Yeah.
need to get out so that we can clean up the rest of the house and really work on the things that are in the way. But the good news is we see what that obstacle is. There's a giant hurdle there, and that's okay. I'm going to boost you up over it, and
Hmm.
we can work together. I do find that one of the hardest things about what we do is really monitoring expectations and making it make sense for people, following through with, conversations on consistency. Because I don't know if you go through this, but I find that once my clients start to feel better, which usually happens pretty soon, I mean,
Hmm.
people are like, oh my God, I feel amazing. Like, this is great. And then suddenly adherence starts to wiggle a little bit,
Yeah.
right? And well, I mean, I had some dairy that I know I shouldn't have had, or I had some gluten or sugar. I had a drink of alcohol, and then it just they're a little bit more stagnant on their progress. Do you find that happens with you?
Oh, for sure. And it is so tough because I do use an elimination diet almost all of the time with all of my clients. I mean, I have to in the gut world because it's just a given. People are going to have food sensitivities, and often it's wheat, but often it's like a lot of other stuff, right? And the more ill they are, the more that becomes like critical because yeah, to your point, we can get people feeling well fast. Typically, it's diet that does that in the beginning more than anything, right? Like the dietary guidance and change we're giving them. But yeah, it is hard because often these are folks that maybe are the rogue people in their own family of origin or their core family they've built with their spouse and their children still at home on that health recovery journey. And best case scenario, their life partners would be on that path supporting them, or their extended family at large would have interest and be curious and asking them questions like, oh, maybe I'll go wheat free if you're going wheat free too. But typically that's not the case. Kelsey. And like, and most people I would say kind of like generally have some degree of support. It's not like typically the people in their life are totally against it, but I would argue that they're going to have the inner resolve and like determination to do this without 100% support of their spouse or other people close to them that are willing to make the exact same changes. And so that's really, really challenging. And I think inevitably what happens is, yes, they get feeling better. And to try to hold a dietary protocol and nutritional change for 60 days, 90 days, yes, that's great. Like that can go by in the blink of an eye, especially when you're starting to feel better. It's kind of getting into the space of if it's a longer term healing process where there's multiple layers of the gut where we might have to rerun the GI map 3 4 times in certain cases to peel back the layers and get all of the work done there, right? Just like with mold and Lyme, that's a long-term process. Like that's easily 18 to 36 to more months of work, right? Like it's not going to happen in a matter of months. And so it's once you get past that initial stretch that people are like, okay, like, but now I'm like going to these family events and like my girlfriends want to go out and well, whatever, I'm feeling better. So I'll just have a glass of wine or I'll just have these appetizers over here. And then they start to fall off the wagon, more and more and more. And then all of a sudden it's like, oh my God, like I'm feeling crappy again. And then they get frustrated. They're like, well, why can't I eat these things? Like I should be able to get to a point where I can eat these things. It's like, well, yes, but maybe no too, because the truth of it is like you in an ideal world, I tell my clients, I'd love for you to be able to get as many foods back into your diet as possible. However, the reality is once you've been ill and the longer you've been ill, chances are really good there are certain foods you are going to have to just avoid. And you're going to know when you eat them because you're going to feel it. And so it does become a choice and it has to become a conscious choice. But the other side of that is if we're still in the healing process and working on these deeper infections or toxins, you're still going to have compromised ability to handle the foods that you might be able to handle once those deeper issues are worked through and they're clear, right? And so
Hmm.
it's that patience game, it's that expectation thing, and it's that realization that, it's not about getting a certain degree better and then taking liberty. It's that feedback loop that we're hoping that they start to buy into, which is like, oh my gosh, like I feel so much better because I've made these choices. And that reaffirms my desire to want to keep making these choices, even if I'm the only one when I go out with my girlfriends, or even if I'm the only one bringing my food to the family gatherings and I'm not eating what other people bring. Right? It is a very difficult choice, but I think once you start to get habituated to living your life, making those like modifications, and you really know that this is actually serving you and getting your health to a higher place, probably even compared to those other family members, it should be an easier choice to make. It should become like, like a habit almost, I would say, right?
Yeah, I totally agree. I mean, how many times have we heard is it's a lifestyle change? It's all about like a complete life change, right? It's a
Yeah.
transformation of your life and your choices. And it reminds me of, one of the things that you had mentioned was, yeah, you might not be able to have this forever. You might not be able to do that. And maybe you weren't ready for it at this time. It's when I work with people metabolically in a more traditional sense, one of the goals that I have for every single person is I'm trying to get you to eat the most amount of calories that are quality calories as humanly possible
Mm-hmm.
without you gaining body fat,
Mm-hmm.
which I think is mind blowing for some people to hear from me because it's like, yeah, that might be for a woman 2,300 calories. If that makes sense for you, why wouldn't you give your body those things? So it's just so interesting. I'm sitting here daydreaming about, Courtney's gut health toxicity extraordinaire. And I'm talking about like the metabolic, a little bit more metabolic hormonal stuff, which I think is kind of fun. And then just like how those pair together in different types of analogies. But it's just really interesting to hear you talk about how someone can be going through how they kind of ease off the gas pedal a little bit
Yeah.
because we all do it and we just do it in different ways. And no matter what that goal is, once we're just a little bit more out of pain, or
Mm-hmm.
we're just, right, our level of motivation is directly related to our level of existing pain in that moment.
Mm-hmm.
And so once that starts to pull off a little bit, or however the case may be, or I don't have insomnia anymore and I'm sleeping, so I'm going to flirt with having wine again with my
Yep.
spouse at night.
Yep.
And it's okay for a week. And then it becomes the conversation of, well, now I'm not sleeping again, but I've been having wine for 2 weeks. So it wasn't that because I would have been not sleeping like 2 weeks ago, right?
Right. Right. Exactly. Right. It's
And
like that kind of slow creep that people don't think about. And that's how we get sick too. That's why I think one of the most confusing looks I get from prospective clients or even clients in the early stages, like, but I just want to understand how I got, like, isn't it because of this? Everybody wants this logical answer for how the body breaks down. It's like, no, it's not like that. Even if you look at like research, like you can see the beginning of the onset of auto antibodies and autoimmune disease like decades before it literally reaches the diagnosable level. Like we're just never going to have a complete understanding of both how we get sick. And then when we get our health back, we can definitely pinpoint, oh, I did this and I worked on this. And this whole combination of changes led to this beneficial outcome. Yes, we have that connection point, but truly, we don't really know what that critical thing was or critical things were. Like, we just try to pull all the threads that make sense that we can based on what we know, right? Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.